your calls for Dr. Zorba Paster at 270-9933.
We have 2 calls open today if you'd like to talk to Dr. Paster. He joins us from his clinic in Oregon. Hi, Zorba.
Hi, good to see you guys.
Good to see you too. While we're waiting for a couple of the calls to clear, tell us about the Only Leaves Should Fall conference. I understand you're doing the keynote address. What's it about?
Exactly. I am lucky to do the keynote address. It turns out falls are a major cause of injury. In fact, if you add up in Dane County, if you add up the number of people who are killed by suicide and murder, as an example, more people died from falls over the last few years than died from all that violence. So in other words, falls are the most likely thing to actually injure you, not somebody else, not a gun. It's falling off a ladder, falling in the house, and we're going to give tips on Only Leaves Should Fall. How to basically look at your house and adult-proof it. Not child-proof it, but adult-proof it to keep those adults from falling. What to do, for instance, in the bathroom with grab bars, what to do about things such as throw rugs, what about ladders, what about safety. And it's all in the name. Only Leaves Should Fall. It's going to be a great conference, and we hope that we're going to get a bunch of people to show up. I've done this for a couple of years now, and I'll tell you something. I think every time I do it, people are amazed on what they can get out of that and what they can learn to make their house and where they live safer.
Good advice. All right, looking forward to that. Let's get to the calls. We'll start with Kathy in Janesville. Hi, Kathy.
Hi.
Hi, what's your
How are
question?
you?
Good. What's your question?
So I have to have a blood test, and I'm petrified of needles. And how long would it take to lower my cholesterol, and could I do anything to speed it up?
So, first of all, you need to have a blood test for your cholesterol, and then you want to get your cholesterol under control, right? Is that right?
Yep.
Kind of two different things. So, first of all, what a lot of people do you faint when you have your blood drawn?
Yes.
Okay, so very important thing. When you go and you have a blood drawn, a number of people do faint. First thing you want to do is you want to say, I'm a fainter, I want to lay down. So you lay down flat. You can't faint when you're laying down. You may not feel perfect, but you can't faint when you're laying down. And if you lay down and get your blood drawn, and then you tell them, I want to stay here for another minute or 2 minutes until I can finally relax and get up, and you get rid of that faint sort of symptoms, you can make a major difference in terms of that fear of having your blood drawn. It's the fear of fainting that usually drives people to that. Now, as far as getting your cholesterol under control, it's a Mediterranean diet that makes a difference. It's exercise that makes a difference. Those are things that make a difference. And, of course, if that doesn't work, there are drugs such as statins that really do make a difference.
Some of it's hereditary, though, isn't it?
How quickly can you do that, Zorba? How quickly, realistically, can you lower your cholesterol?
First of all, if you're on a diet, it's probably about 3 or 4 months. You know, you really want to make a difference. It's not a few weeks. It's probably, I would say, if I put somebody on a diet, I'll say, come back somewhere between 3 and 6 months. Let's look at it again. Unless it's in the, emergency danger, cholesterol that's maybe 350 or something like that. If you're on a medication, it generally takes anywhere between 3 and 6 weeks. So medication is quicker. Diet is there, but once again, it's really a lifestyle change that really helps.
Okay, got to keep track of it. Let's go to Sylvia in Madison. Hi, Sylvia. Sylvia, you there?
Yes.
What's your question?
I'm 68, and my right knee is bothering me more and more. It gets sore. I take Anacin or lately Aleve for it. I'm wondering when I should consider knee replacement and or any steps in between.
Oh, sure. First of all, very, very good question. Generally, you do knee replacement when everything else fails. And so everything else fails means either an anti-inflammatory taken on a regular basis. If you can tolerate 2 Aleve twice a day, is an excellent over-the-counter anti-inflammatory that really can make a difference. And the second thing that's really important is physical therapy and exercise. Time and time again, people do not do enough exercise for their knees. And what you want to do is go to a physical therapist who knows what they're doing, ask your doctor, have 1 or 2 visits to learn how to exercise, and do it once a day or twice a day for 12 weeks. Then you'll find out. If after 12 weeks you're not any better, then generally I would say often having knee replacement is going to make a difference. But a lot of people do exercise maybe for a week or 2 and they say, I'm not any better. It generally takes anywhere between 8 and 12 weeks if you have arthritis to really get it to sink into that body and make your knee better.
All right. Let's go to Ellie in Madison. Hi, Ellie. What's your question?
Yes. I recently took a fall in my kitchen. I have carpeting everywhere else, but it's cement with hard tile over it. And I injured my back again.
Wow. Wow. That can be very, very dangerous. Very dangerous. Do you have any throw rugs in your kitchen?
No, and the one that is at the sink is got some stuff under it so it doesn't slip.
You've got to make sure if you've got a throw rug that it's really totally sealed down in there. Better not to have any rugs in the kitchen, and best to keep that kitchen dry. Once again, only leaves can fall. That's where we give lots of tips on trying to help people quit falling.
Important advice. All right, Zorba, we are out of time. Thank you to everyone for calling in. Thank you for your time, Zorba. We'll see you next time.
See you.
Good to see you.